administration. We're going to bring in our panel now to discuss this. First, we have Betsy McCaughey, a health policy expert, with us on the phone, and Darrell Henry, the executive director for the Healthcare Coalition for Emergency Preparedness. Thank you both for being with us today.
Good morning.
Thank you.
All right, so Darrell, we'll start with you. And Frontier Airlines, they say they cleaned the plane that transported the second patient 3 times, and they plan to remove seat covers and carpets in the immediate vicinity of where the passenger was sitting. But of course, this was after the flight made several stops. A lot of other folks were on that plane. Is Frontier Airlines doing enough?
Well, obviously they didn't know about the patient and until much later. So as of when they learned it, yes, they're working to do what they need to do, because it's all about transmission of the disease through fluids. It's just the scary part is who came in contact, potentially in contact with any of her fluids before they cleaned the plane.
And Betsy, what do you make of this report that the nurse was given permission after treating Thomas Duncan to go to, I think, a wedding in Cleveland?
Well, it's shocking. First of all, the original decision that the CDC made, like all of the decisions they appear to be making, was done for political reasons, to support the president's political agenda, not banning flights from West Africa, rather than protecting the safety of the American people. The fact is that she and the other healthcare workers, all 77 of them, should have been on the list of people who were under very close scrutiny by the CDC. But Frieden didn't add them to that list. He kept it to 48 people because 48 sounds like a pretty low number. Over 100 sounds like a big number. That was the first mistake. That should never have happened. Secondly, contagion is a gradual thing.
Yeah, Betsy, is Betsy still with us? I think we may have lost Betsy's connection there. Darrell, let's pick this up with you. When we hear from the CDC today, from Dr. Thomas Frieden, we also hear from folks from Texas Health Presbyterian Hospital. In your opinion, who do you think has more explaining to do today at this committee hearing, the CDC or the hospital? Because a lot of folks are still asking the question, and we don't really know exactly how these 2 nurses were able to contract Ebola despite the protocols that were in place.
Well, CDC itself has put out warnings to hospitals and told hospitals to be prepared and provided protocols and information to the hospitals. Obviously, with the stories coming out of Presby, they weren't prepared and they weren't following protocols. So that is a dangerous situation that has gone on down there, and it's obvious the repercussions are coming out. We've yesterday called upon state, local, and federal health officials to work together so that you have a plan. If you have an Ebola patient, it goes to the right facility that can treat the patient with complete staff training and complete infection control guidelines, so that waste is taken care of on-site and treated and sterilized right there. So you have a complete infection control program, which was obviously missing at Presbyterian.
Well, Betsy, Darrell says the hospital should really shoulder more of the blame here for what took place down there. What's your opinion? Is it more the CDC's responsibility for not being proactive enough, or is it more the hospital's responsibility here for these 2?
Let me make it clear. A protocol is not a protocol if one misstep threatens the imminent death of healthcare workers. That is not an acceptable protocol. And we know from watching the 277 doctors and nurses in Africa who have died treating Ebola patients, the nurse who is now clinging to life in Madrid having treated an Ebola patient, that it is a dangerous mission. Even just removing the protective gear, one misstep, such as the nurse brushing her gloved hand against her cheek, can result in death or near death. So the point is, we should not be confronting our healthcare workers with this situation. Don't blame the hospital. We shouldn't have any Ebola patients in this country.
All right, we'll talk a little bit more about this and those travel bans that other countries have put into place. Why isn't the United States doing the same thing? More on Ebola with Betsy McCaughey and Darrell Henry right after this commercial break.